5 years ago, the Volunteer Health Service started with Hywel University Health Board, and initially it became quite evident from inquiries we were getting that there were some prospective volunteers with communication difficulties, speaking to them on the phone, and when received application forms from them, it was obvious that some people were struggling to fill them in. So that was our initial issue. We did a lot of work with speech and language therapists in the Learning Disability Directorate in Carmarthenshire. And they have service users who help support their service, doing various activities as informal volunteers. And they'd asked us if we could recognise them as formal volunteers. And so we said yes, we could do that. But in doing that, it meant that because the service users had communication difficulties themselves, we had to develop our volunteer application process, induction process and training process as well to make it very, very accessible to them. So in doing that, it meant that through developing accessible information, the inquiries that we were getting from people, those with communication difficulties, when they were speaking to us on the telephone, we could then offer them an easy access volunteering pack, which helped us and helped them.
Well, like David said, we had several service users with learning disabilities who were already carrying out a role for us in terms of shaping the service, shaping policies, developing packs and procedures, but we weren't able to formally acknowledge the work that they were doing. So when David's project came along, it was really good working in partnership with the volunteering service, because we were able to sit down, take a good look at the induction packs, and with service users involved, decide how to make them more accessible so that people with both profound and multiple disabilities and people with mild learning disabilities could be involved.
It means that we can provide accessible information for a wide range of volunteers, prospective volunteers in the community. So we're opening up our doors to perhaps a section of the community that wouldn't have otherwise been tapped into.
And the volunteers themselves express the benefits that it's had for them in terms of improving their confidence, allowing them to have a role in society perhaps they didn't have before. So it's been really, really valuable.
It also gives the service users with learning disabilities and people in the community an opportunity to engage and be involved in the University Health Board services.